Hello, everyone, and guess what? Who's with us? Dr. Aakash himself. Dr. Aakash scored the rank 4 in this recently conducted NEET PG exam, and Dr. Aakash is with us live here. So, Dr. Aakash, congratulations, man.
Thank you, sir. Thank you so much.
Dr. Aakash, before we start with the formal interview, I want you to introduce yourself. Tell us about that, where you belong to, and which college you did your MBBS from.
Sir, I am currently an intern at Government Medical College, Baroda, Gujarat, and I have done my schooling from Baroda as well.
Okay.
And my other interests, apart from studying, have been taking part in parliamentary debates, presenting research papers, medico-legal law, and reading judgments. So, keeping up with the current affairs. So, these are the few extracurricular activities I've been indulging in.
So, are you planning for some UPSC or something after your, after your MD itself?
Sir,
Is
I
it?
had given the law exam because I had an aspiration of becoming a lawyer once. So I just gave it a shot.
Oh, wonderful, man. That is wonderful. Dr. Akash, first I wanted to know that when did you actually started preparing for these exams? You'll find the people of every trade. You will see some people start preparing at in second year, some people intern, post intern. So आप कब एकदम serious हुए कि हाँ यार कुछ सोचना पड़ेगा, like I have to like start preparing for the PG exam?
Sir, I mainly started in my final year. I feel that I started a bit on a later stage, but I don't think the absolute duration of it matters. Like you mentioned that seriousness component, you can start it in second year. If you're not serious, that year won't count. So for me, that seriousness came about like mid of final year, which was 2021, or June July ke waqt. So that was when that I have to now make all the notes. I have to get over all the subjects once before I enter internship. And that is when I started like formally preparing. So a 1.5 year journey.
Well, I do not want to encourage anyone to start a little late, but I conducted an interview for rank 2 also, and he's also from Ahmedabad. He also
Yes.
did.
Prem Tilak.
तो अभी मुझे ना impression ऐसा आ रहा है कि people in Gujarat they start late, but वो late start करके भी ना they still win the race only
Yeah. So
after a final year, and you started in your final year. So well, that's a great achievement to get the single digit rank सिर्फ एक डेढ़ साल के अंदर. So well, many congratulations for that. Uh, Tell me, Akash, were you expecting such a good rank when you gave this exam, or like कुछ लग रहा था कि आपको कि हाँ the exam went well और कुछ तो अच्छा rank आएगा?
sir, I think that when I exited the exam hall, I exited with wo jo 5 stages of grief hote na. I exited with acceptance. Like I was never in denial, nothing. Just the acceptance के साथ निकला कि okay, the exam went well, I did my best. फिर result matter नहीं करता. फिर I came home, recall videos were bombarded, like they are doing live recalls. Every faculty is trying to put forth their correct version of the question, and in that I started to get questions which were incorrect. So that led me to believe that I would not be getting 660 640 जैसा, मतलब उतना ही मैं एक्सपेक्ट कर रहा था कि 20-30 तो गलत हो ही जाएंगे मेरे. But yes, it was not that I had expected to be like get a single digit rank.
Okay. So, Dr. Akash, you said you started preparing final year. So, how did you manage your final year? So, already it's very overwhelming. So, how did you manage to start from final year? Like, were you focusing only on the final year subject then, or were you like started with the pre-para clinical also?
Sir, my main focus was to get my notes of all the 19 subjects. So I started off with my pre-paraclinical because those were the ones which I had the least studied in proximity. Final year चल रहा था, तो I had studied something. Third year का भी पढ़ा हुआ था. But first, second year was very, it had been 1 or 2 years since I had studied those subjects. So I started off with those subjects, and my main strategy was to get those 19 subjects notes over with.
Okay, so you basically read all the subjects of and second year in the beginning of final year itself.
Yes, in the beginning of like final year, I managed to complete those subjects.
Okay. And but what would you suggest ideally that when a person should start preparing for these exams? Like, आपको क्या लगता है कि if you would have started early, if you get a chance to like start preparing it again, so when would you start it here?
Sir, I feel to be very honest, I think that I started preparing in my first year because I was a student who used to attend dissections, used to discuss like see histology slides अच्छे से, pathology की slides, the specimens अच्छे से. So it was not that I just like started in like my final year or third first. I would recommend everyone what I personally think is that you should start from day one. Like not to get a rank. That should not be your aim. I feel that your aim should be that you need to get that knowledge like from any source that is possible. So if you are so starting as early as possible, like formally for PG, I think third first or third final is standard. But if you are focusing in classes before that, I think some way or the other that helps you as well.
So, did you stick to the standard textbook in your the first and second year, or like you like chose some shortcuts to just cross the prof exam?
No, sir. I always loved reading textbooks. So first, second year, mein, I had read the standard textbooks. Especially Guyton was one of the best books I've ever read. Like I didn't read Genong. मुझे Guyton बहुत अच्छी लगी थी. Grey's Anatomy I used to refer for mainly the images instead of netters. I had Grey, so मैं Grey की images कर लेता था. So yeah, first second year, mein, I managed to read standard textbooks. In my final year, mainly those the information I used for my NEET as well as my prof exams were mainly from my notes. I couldn't manage to read the standard textbook because I had a bit on a time crunch.
But anyways, if you read like second year very well, first year very well, तो आपको वैसे भी final year में मुझे लगता नहीं कि you have to read anything like standard textbook and all. If you're good at pathology,
Yes, I completely agree. That is the correct approach. Like instead of reading medicine, if you read patho better, you will be able to solve majority of the medicine questions.
exactly. So which again brings me to my next question here, which I am actually asking every ranker here. I really want you people to address, and I really want to ask this question, especially to the rankers, top rankers here, that ये जो mindset अभी आ रहा है ना कि अभी the next is round the corner. So you may have the next exam in 24 or maybe next year, जब भी होगा.
Yes.
So people who are coming in first year and tough time in your clinicals here. So they think like we should not take first and second year seriously, and we'll start preparing like for the third year of clinical subject right from the later part of first year itself. So what is your take on that? Like how should they approach it?
That should
I know it's
be
laughable.
highly discouraged because yes, they are saying that they are going to ask medicine. No one has seen next paper okay, how the difficulty will be or how the question will be framed. They have already mentioned that this is going to be medicine and allied subjects. So what dermat bhi dalenge, wo log first second year bhi dalenge, right? Because every doctor you speak to, like including my parents, Papa always says that the like anatomy that he has read of abdomen, all those things still helps him till date. So I'm not sure that any faculty will uh, only like make questions of final year that 60 question and 120 question of medicine. A lot of them will be first second year, and if your first second year is strong, that's what happened for me. That मेरे जो questions wrong हुए, that like from surgery, from radiology, from gynecology and ENT, and 1 2 questions from PSM. My first second year में I had 100% correct correct answers in those subjects. So I think that once you're very strong in those, you can afford to make mistakes on some of the tricky subjects because no matter how much gynec you read, how much
Yeah.
medicine you read, you'll always be getting some or the other question which you'll not be able to solve. But in anatomy and all these first, second year subjects, there is no scope for that. So I would give this message to the people who are preparing and worrying about next is that don't focus only on the final year subjects. The final year subjects are actually first, second year subjects with just treatment and management and charts and guidelines extra. One are their first, second year only.
Exactly. And this recently conducted NEET exam was a big example for that. Like
Yes.
when I was all for anatomy, like although the straight anatomy questions were like only 4 or 5 only, but when I
Yes.
look at like, the clinical questions, the so-called clinical questions can be done by the simple anatomy itself. So I had ultimately the recall came down to like 17 questions, 17, 18 questions,
Oh,
which is a
right.
big.
Yes. Yes, I agree. Like the orthopedics की nerve injury वाला जो question था, median nerve, if I'm not wrong. So वो question is like we studied like in first year. Now अच्छे से पीछे they are given the nerves. injuries and all. So you have to solve that from first, second year. You don't have to wait till ortho to solve, like to get that knowledge on how to solve the question.
Yes. Acha, Dr. Akash, tell me that were you a GT person? Did you give grant tests, and what was the frequency of the grant tests that you gave? Because you started preparing in your final year, so when actually you started giving grant tests, or आपकी frequency क्या थी?
Sir, I gave my first grant test on 28th February 2022. So just like 2-3 days after my final year exam ended, that was the first GT I gave, and I managed to give over 50 to 40 GTs जैसे मैंने दिए थे overall.
Okay. 40 to 50.
The frequency should be like, I feel that for me GTs were always that I give them during my free time or sometimes when I don't feel like studying. So if you can incorporate that's well and good, but if you like want to give regularly every Sunday or you want to have that schedule with you, I feel that starting with once every month, or I would go as far as once every 15 days since the first like initial days of the preparation, because no matter how many subjects you have studied, that doesn't matter. You have to make sure that whatever you have studied, are you able to get GT questions of that subject correct? That is the main aim. Your aim is not to get 160 correct since April this year if you are preparing for next year, for example. If you have studied anatomy, you have to get 10 में से 8 से 9 questions correct. That is what your aim should be.
Yes, yes. And eventually, let's say if you're preparing for anatomy or physiology for that matter, तो वो आपके दूसरे पार्ट में रिफ्लेक्ट होता है. You obviously will get some of like ENT question or surgery question also correct because you are like good at
Yes.
that. So एक eventually जो cumulative score है that increases by itself here. So
Yes.
generally the first GT होता है that's usually an eye opener. Okay, where do we stand? And then
Yes.
from how the graph goes on. Well, wonderful. Dr. Akash, tell me about, did you also follow the concept of the 20th notebook, they call it, na? कि last में revise करने के लिए we need to have
Yes.
concise something, so that basically I'm asking you that how you manage your last 7 to 8, 10 days before the exam,
Yes, sir.
how you revise the entire stuff.
Yes, sir. Sir, honestly, I was never a schedule person. मैंने कभी लाइफ में शेड्यूल नहीं बनाया. नीट यूजी से मैं बता रहा हूँ, 10th बोर्ड से, अगर आप if you want to go that far. I made the first time मैं लाइफ में शेड्यूल बनाया and I'm very happy कि मैं कर पाया. लास्ट 15 डेज का मैंने शेड्यूल बनाया था. सारे 19 सब्जेक्ट्स कवर हो रहे थे. लास्ट 7 डेज का अगर स्पेसिफिकली बोलूँ तो संडे को I did pharmacology for the second time in the 15 days only. Pharmac, pathology, sorry, pharmac, then PSM, microbiology, biochemistry, anatomy. These, I think, the 5 of the most volatile subjects of MBBS. तो लास्ट 5 डेज में मैंने लास्ट 7 डेज में से लास्ट 5 डेज में मैंने ये सब्जेक्ट्स खत्म करे. लास्ट 2 डेज में आई हैड स्क्रीनशॉट्स ऑफ द क्वेश्चन बैंक, so I took those. Then I had some pages folded in my notebook. Like I had folded this page. I had some photos, like I had taken like photos ली थी मैंने. तो मैंने लास्ट 2 दिन वो सब वापस से रिवाइज किया. तो मैंने पर्सनली 20th नोटबुक नहीं बनाई, बट द अदर वे राउंड, और दी इफ यू आर नॉट अ पर्सन जो 20th नोटबुक बना पा रहा है, तो आई वुड सजेस्ट दैट यू हैव सम टॉपिक्स इन योर हेड दैट यू हैव टू डू दिस, like mainly from your previous year topics only. You have to do this, like volatile की कोई values हो गई, RDA हो गया तुम्हारा, like you have anatomy के there's some root values. Yeah, last दिन तक I was studying के phrenic nerve मुझे बहुत मुश्किल होती थी. phrenic nerve हो गया, cremastic reflex हो गया, बैरल्जिया पेरिस्थेटिका बहुत कंफ्यूजिंग लगता है. L1 L2 कौन सा, L2 L3 कौन सा. लास्ट दिन तक you have to read that, right? Because वो question very likely that those type of question which are having L1 L2 L3 L5 L6 L7 sorry L7 L S1 S2 in the options. So both you have to do till the last stage. So you have to make a note of this volatile topics that you're getting wrong in GTs again and again, and previous year questions, and you have to get a compilation. Doesn't necessarily you have to write them down in a 20th notebook, but you must have something with you that you are able to revise in the last 15 days.
So basically you had a plan कि ठीक है मुझे
Yes.
I have to look into those snapshots that you've taken or जो मैंने
Yes.
folded. So it's a kind of 20th notebook for you.
20 note.
Version of 20th notebook here.
Yes.
Basically the point is कि you need to have a plan so that you can revise this entire stuff in those last 7 to 10 days, because no matter how much work you have put in like in your last 4 or 5 years of MBBS, but it all boils down to those 6-7 days only.
Completely agree.
If you like not able to revise the entire stuff, चाहे वो एक बार खाली skim reading हो, then you're never in a good frame of mind when you go to the examination hall.
Almost impossible to solve the questions which you have read like 2-3 months ago. 2-3 months तो मैं ज्यादा बोल रहा हूँ, 1 महीने पहले भी if you are honestly read बहुत अच्छे से तब समझ आ गया, फिर एग्जाम में नहीं हो पाएगा वो.
डॉक्टर आकाश, चलो ये तो ही बहुत सारी एकेडमिक बातें. आई आई आल्सो वांटेड टू नो पर्सनल क्वेश्चन दैट व्हाट डू यू लाइक टू डू इन योर फ्री टाइम, लाइक पढ़ाई के अलावा और क्या करते हो यार? बिकॉज यू आल्सो, दिस इज अ ब्लेसिंग इन डिसगाइज व्हेन यू हैव अ रैंक 4 अटैच्ड टू यू ना, तो दिस इज आल्सो स्टिग्मा टू यू, यार ये तो पढ़ता ही होगा और कुछ नहीं
पढ़ता
करता.
ही रहता है सर. तो मेरा मेनली था सर, वन थिंग दैट आई यूज टू डू इज आई यूज टू डू कृष्ण महामंत्र. लाइक
ओके.
हरे कृष्ण, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे. मैं एग्जाम के मतलब जब 40-50 मिनट्स आप तुम पहले चले जाते हो, सीट हो जाती है, सब बैठे होते हैं, एक दूसरे को देख रहे होते हैं, टेंशन है, वो मुझे लिटरली वॉक कर रहा है कुछ फॉर्म चल रही है, तो उस बीच आई मैनेज टू डू 108 जो माला होती है मतलब विद माई फिंगर्स. तो मैं वो कर लिया था. एंड इवन इन माय फ्री टाइम, लाइक नॉट द एग्जाम डे बट उसके पहले भी आई यूज्ड टू यूटिलाइज दिस फ्री टाइम. समटाइम्स स्पिरिचुअलिटी या कुछ सॉन्ग सुन लिए जो थोड़े मतलब भजन हो गए, या फिर सम दो स्पिरिचुअल लेवल्स ऑफ सॉन्ग. अपार्ट फ्रॉम दैट सर, अभी तो नहीं बट इन माय इनिशियल टाइम्स ऑफ माय प्रिपरेशन, तब जो फ्री टाइम मिलता था, तब आई यूज्ड टू मेनली फोकस read about the current affairs. I enjoyed taking part in model United Nations and British parliamentary debates. So I always used to be reading the newspaper. So keeping up with the current affairs is also important. That you have a conversation, are able to connect with other people from other fields as well. So I mainly used to read these things in my free time.
Okay, that is wonderful. So do you like to play any outdoor games as well?
Yes, sir. So I used to play football. I अभी तो मतलब fitness थोड़ी down हो गई है, but पहले I used to also I was also a try athlete. So swimming, cycling, and running.
Oh,
Uh, so I had taken part in 3 of them, and mainly my football with my school friends. वीकेंड्स पे हम मिलते थे, संडेज को प्लान बन जाता था, तो हम घर पे, मेरे फ्रेंड है अमन से, घर पे वी यूज टू प्ले. लाइक मेनली मेरे स्कूल फ्रेंड्स होते थे फ्रॉम ऑल डिफरेंट फील्ड्स, एंड सम ऑफ माय मेडिकल फ्रेंड्स एज वेल.
okay. You know, again, you are the second person who's like advocating football, because again, I took an interview. As I said, another boy from Gujarat only, and he also said he like loved to play football. Although
या.
our club choices didn't match, but ठीक है, that's okay.
ओके.
Like, so I love to play football in my free time. Acha, Dr. Akash, you are done with your rank. You got rank 4. You can pick the college of your choice and seat of your choice. By the way, what exactly are you planning to take up for your PG?
Sir, as of now, I have not decided the city, but I would prefer, most probably be going with internal medicine.
Internal medicine. Okay. And will you be appearing for the INI-CT only, या फिर अभी हो गया, like rank 4 से ऊपर क्या चाहिए अभी?
नहीं सर, एक्चुअली मैं फिफ्थ को एग्जाम खत्म हुई थी. आई डिसाइडेड आई टेक 1 डे ब्रेक जो होली के दिन मैंने ले लिया था, और सिक्स से आई स्टार्टेड फॉर प्रिपेयरिंग फॉर आईएनआईसीटी. लाइक दैट वाज पहले से ही मेरा टारगेट, नॉट पहले से बट नवंबर दिसंबर से आई स्टार्टेड टू थिंक कि प्रोबेबली दैट्स आल्सो पॉसिबल. दैट्स नॉट आउट ऑफ रीच बिकॉज मोस्ट पीपल थिंक आउट ऑफ रीच है. तो या, आईएनआईसीटी स्टिल द preference that I would like to give over NEET.
And moreover, getting a single digit rank will play a good, very great booster for you. You know कि you have secured such a good rank ना, तो एक state of mind बहुत अच्छा है अभी
Yes,
आपका ना. You should go for it.
yes,
अच्छा, you know that I'm sure you must be having so many friends around you कि जिन्होंने hard work तो किया, but they were still not able to fetch the rank.
yes,
And I want you to just be in their place and kind of be a mentor for them. As I said, it is kind of social and moral responsibility of us to kind of take care of those people as well.
yes,
And
sir.
तो INI-CET आने वाला है. You being a ranker, you are already there जहाँ पर होना चाहिए आप. तो आप बताओ कि what should they do अभी like we have couple of months with us. So what is doable in this given span of time so that they can perform like decently in the upcoming INI?
Yes. Sir, I first of all feel that it's very difficult to be in their place, because when I gave the NEET exam and मेरे गलत होने start हुए, मुझे बहुत ज्यादा सीवियर सेल्फ डाउट होने लगा कि मैं नहीं निकलने वाला, ऐसा करके मुझे बहुत ज्यादा सेल्फ डाउट होने लगा. एंड आई एम श्योर दैट जिनका रैंक स्लाइटली लाइक इवन 200-300 विच दे थिंक के यार मैं टॉप 100 में आ सकता था, लाइक सीइंग देयर फ्रेंड्स. तो मुझे ऐसा लगता है कि इट्स वेरी डिफिकल्ट to be in their place. But if I would like to give them some advice, my advice will be that I don't think top 500 के कुछ knowledge में फर्क है, right? I don't think there's a very significant difference in knowledge. And I always feel, and I've told my friends also openly, that I feel one, that INICT is easier than NEET because it is very predictable. Previous year questions and some special topics like cadaver image and trauma ये सब ज्यादा पूछते हैं. Second thing, I feel that INICT में एक पॉइंट का नॉलेज काम नहीं आती. There are questions which baffle the faculty, which you are not able to find it anywhere. Internet, journal, ऐसे जगह से मिलना पड़ता है आंसर्स. तो वो क्वेश्चंस किसी को नहीं आने वाले. तो अगर तुम्हारी नॉलेज is not a limiting factor in INICT, like it sometime might be NEET because it's a highly much more competitive exam. तो I think that एम्स में वो नॉलेज एक पॉइंट पे खत्म हो जाती है. तुम्हारे इंट्यूशन, तुम्हारी रूलिंग आउट, लैटरल थिंकिंग, तुमने वर्ड्स कितना अच्छे से अटेंड किया है, आर यू एबल टू पुट योरसेल्फ इन द शूज ऑफ द एग्जामिनर एंड सॉल्व दैट क्वेश्चन, वो सब चीजें एक पॉइंट पे ज्यादा काम आती है. तो इवन इफ टुडे यू फील दैट योर रैंक इज डाउन बिकॉज यू हैव लेस नॉलेज, I still believe that INICT is not like about a certain point is not about knowledge. Like you cannot crack the INICT on knowledge. You have to crack INICT on lateral thinking, elimination, GT, time management. ये सब more matter. ज़्यादा matter करता है than just knowledge.
Well, very well put. I totally agree with you that all the people in top 100, 200 को बहुत difference of couple of questions. किसी का दिन है, किसी का नहीं है, and like we should believe that we are fortunate one to be here.
Yes.
And so, well, Dr. Aakash, thank you so much for your time. I thoroughly enjoyed talking to you.
Yes,
And
sir, I had a
great pleasure talking to you and knowing that what your strategies were and how you went about it. It's a wonderful journey. I'm sure people will take inspiration from this.
Thank you, sir. Sir, before ending, I had a few words to say. Sir, I would like to thank the Almighty God, Krishna Bhagwan, and my parents, my sister, my grandparents, my school friends, my college friends, Punya, Santosh, Ravish, everyone, that they have been a very integral part of my journey. That I would not have been like the belief that my college mates had on me. Ke Aakash, tu rank लाएगा, मतलब you will make our college proud. So that feeling when you get ke मतलब you have a big responsibility. So एक पर्सनल चॉइस है कि चलो मुझे ये मेडिसिन अच्छे कॉलेज में चाहिए. बट व्हेन यू हैव दैट बिगर सॉर्ट ऑफ गोल इन लाइफ कि तुमको अपने कॉलेज के लिए करना है, तुमको अपने पेरेंट्स के लिए करना है, आई थिंक दैट ट्रम्प्स एनी सॉर्ट ऑफ मटेरियलिस्टिक और एनी सॉर्ट ऑफ short term goal that you have in mind. You want to become a medicine XYZ college say. So I think that the belief that my friends had on me, I think that is the real reason probably that I was able to score, and that day went well because I had blessings of so many people over with me today.
Well, very well put. Our college has given us a lot, and this is the best thing we can do for them, like fetching a rank and putting the college name. Because obviously, your rank, you will be known along with your college. People will be chanting your college name also for a long time. That someone from that college got a great rank. So I'm sure that you made everyone proud. Your professors,
yes, sir.
Your colleagues, your juniors, seniors, everyone. And just like everyone, we are also extremely proud of your achievement. So once again, many congratulations and all the best for the future.
Thank you, sir.
Thank you. चलो आकाश, थैंक यू सो मच यार.
थैंक यू सर, थैंक यू सर, बहुत अच्छा लगा आपसे बात करके.
थैंक यू सर.
The team will edit it till here. And तो आकाश अभी कहाँ पे हो आप? You are in like right now you are in which city अभी फिलहाल?
Baroda.
You're in Baroda only.
Yeah.
You are in the rank 2 is also in Baroda. Like what is going on there, right?
Premta is my very good friend. We were in same school, Navrashna. 11th, 12th we did same. We were in constant touch. Like GT का स्कोर पूछते रहता था कि तेरा कितना है, मेरे कितना है. तो मैं और प्रेम तो काफी क्लोज फ्रेंड्स है. Like हम क्विज़ेस में भी साथ में गए.
Why there's so much of similarity? You both love football also. Like
yeah, I think
yeah, Prem and same school. I think more than your medical college, your school will be proud of you. Like your school
yes,
will
sir.
be.
School से 3 रैंक है sir. Under 11, Punya is also from my school. Prem is also, and I am also. So, Navrashna school जो हमारा है उससे like 3 are under 11. So I think that history में पूरी पूरी इंडिया की हिस्ट्री में ऐसा होगा कि स्कूल से इतने ज्यादा रैंक आए. city तो चलो छोड़ो, school like school friends are at that top, so that's a very different thing.
Wonderful. अभी तो मैं कह रहा ना, your school will be is going to be a like the biggest target for the their kids at school. अभी उनको बड़ी मुश्किल होने वाली है to get like our school to produce the toppers in NEET exam like
हाँ,
wonderful. तो बहुत ही मजा आया सुन के इस बात को। तो ये so we have rank 2, rank 4 and rank 11 from that call. So the
इवन
same
राहुल से मेरी बात, मतलब राहुल से इतनी ज्यादा बात नहीं होती थी, रैंक 9 था, बट या लाइक हम क्विज में मिले थे तो वी हैड अ चैट ऐसा करके, सो मोस्टली आई,
the same school only,
नो नो, राहुल इज नॉट इन द सेम स्कूल.
but he's from Baroda,
आई एम नॉट श्योर, आई थिंक ही इज फ्रॉम अहमदाबाद मोस्टली.
but from Gujarat itself, right?
या गुजरात से वो भी.
Wonderful. Okay. ये ना एक like because on the personal note ना एक time
यस
आता है,
सर.
आपने शायद ये नोटिस नहीं किया बिकॉज वी बीन टीचिंग फॉर अ लॉन्ग टाइम ना आकाश। अभी बीच में एक टाइम आया था ना, जयपुर राजस्थान हैज बिकम अ एपी सेंटर फॉर द रैंक्स। एसएमएस जयपुर,
नीट यूजी की बात कर रहे हैं कि अभी?
नीट पीजी में ना
अच्छा.
एसएमएस जयपुर ना रैंक निकाल रहा था 157 लाइक दैट। देयर वाज द टाइम केजीएमयू लखनऊ से रैंक आ रही थी। एंड व्हेन यू पुट योर कॉलेज और यू नो सिटी ऑन द मैप ना, ये एक अलग तरह का ना एक फीवर शुरू हो जाता है वहां पर। पीपल स्टार्ट बिलीविंग इन दिमसेल्फ कि यार हाँ, बड़ौदा से भी 2 बार रैंक आई यहाँ पर। अशरफ वानी ही
अशरफ,
गॉट अ
मैं वही
रैंक।
बोलने वाला था अशरफ भाई का कि या मैंने भैया का इंटरव्यू लिया था, उस टाइम अशरफ वाज देयर, संविद वाज देयर, निर्मित एंड एक और, सॉरी नॉट एबल टू रिमेम्बर द नेम. सो अंडर 100 में 4 लोग थे, इस बार अंडर 100 में 3 है ना, उस बार अंडर 100 में 4 विद 1 इन एआईआर 1. तो भैया को देख के भी मुझे ऐसा हुआ था कि मतलब वेरी, और आई थिंक उसके 2 या 3, उसके एक ही साल पहले 18 या 17 में राजकोट से रैंक 1 आई थी, पीडीयू राजकोट से. तो मतलब उनको भी देखकर, अशरफ भाई को भी देख के, फिर आकांक्षा की भी आई थी रैंक 13 2020 में. तो एक अलग मिलता है कि मतलब क्या ये छोटी सिटीज वेरी वेल बी एबल टू बीट दिल्ली, बॉम्बे, लाइक इफ यू वर्क हार्ड इनफ.
जब से ये जब से ये अवेलेबिलिटी हो गई ना सबको कि वी आर हैविंग लाइक ऑल डिफरेंट प्लेटफॉर्म्स अवेलेबल एवरीवेयर इन योर फोन एंड ऑल, तो अभी ये अच्छा लगता है देख के ना कि पीपल फ्रॉम एनी सिटी कैन ड्रीम ऑफ एनीथिंग। लाइक दे कैन, इट
अग्रीड.
डजंट मेडिकल कॉलेज से एमबीबीएस कर रहे हैं जिसका आपने नाम भी ना सुना हो, दे कैन इवन थिंक ऑफ डूइंग अ मेडिसिन फ्रॉम एम्स न्यू दिल्ली। तो लाइक ये बहुत अच्छा है। इट लुक्स लाइक अ वेरी देयर वाज अ टाइम व्हेन एवरीवन वाज गेटिंग अ रैंक फ्रॉम दिल्ली, मुंबई, बैंगलोर, सिर्फ ये मेजर सिटीज से रैंक आ रही थी।
अग्रीड.
सो पर्सनली ऑन अ पर्सनल नोट, बिकॉज इट इज नॉट अ पार्ट ऑफ इंटरव्यू, मुझे तो बहुत अच्छा लगता है व्हेन आई सी ना समबडी लाइक फ्रॉम बड़ौदा से या फिर कोई और दूसरा सिटी
थर्ड,
से।
सेकंड या थर्ड ईयर सिटी से जो कोई रैंक लाता है.
दैट रियली गिव्स मी सच अ गुड थिंग कि हाँ यार, कि नाउ एक 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 यूनिफॉर्म प्लेटफॉर्म है, अब आओ सब
हाँ.
लोग,
यस यस.
है ना।
लाइक पहले वो होता था ना कि देयर इज सम एक्सेसिबिलिटी, लाइक उधर की फैकल्टीज अच्छी है, लाइक स्टूडेंट्स अच्छे हैं, वो सब है. बट वंस यू हैव लाइक इंटरनेट एक्सेस एंड एवरीथिंग, इट्स इज लेवल नाउ, हार्ड वर्क and all those things now matter more than where actually you're doing your UG from.
चलो यार आकाश, बहुत मजा है आपसे बात करके,
और
ठीक है।
सर मुझे भी बहुत अच्छा लगा.
रियली विश कि मैं तुम्हारा इंटरव्यू दोबारा लूं। आई
थैंक यू
नाइस
सर.
मे विल यू नेवर नो, हो सकता है रैंक 1 लिखा हो तुम्हारे सामने उस टाइम पे। एंड लाइक ऑल माय ब्लेसिंग्स एंड गुड विशेस टू यू।
थैंक
आई
यू
रियली,
सर.
चलो मैन, थैंक यू एंड गुड नाइट एंड हैव अ गुड
गुड
टाइम।
नाइट सर. थैंक यू सर.